A CT scan costs anywhere from $300 to $6,750. A heart stent procedure running between $11,000 and $41,000. A knee replacement averaging $31,124. What do these numbers have in common? They're all medical procedures that can financially devastate an uninsured family overnight. I am Ron Siegel, certified liability advisor, helping families build wealth through strategic debt management. Here's something most people don't think about when they skip health insurance to save a few bucks each month. They're not just risking their health, they're risking everything they've worked to build financially. I had a conversation recently with a couple in their early 30s, both healthy, both working, both convinced they didn't need health insurance. We're saving $400 a month, they told me proudly. Then their youngest had an accident on the playground. One trip to the ER, some imaging, and a minor procedure later, they were staring at a bill for $18,000. Ow! That savings they were so proud of, gone in one afternoon. And now they had a debt that looked a lot like a car payment, except this car wasn't sitting in their driveway. Here's what the numbers actually look like. According to the Kaiser Family Foundation, the average benchmark health insurance plan costs about $477 per month in 2024. Yeah, we know the prices are going up. That's $5,724 a year, but here's what most people miss. With premium subsidies through federal and state programs, that monthly cost can drop to around $66 nationally. Think about that for a moment. We're talking about roughly $800 a year versus potentially tens of thousands of medical debt. So what does this mean for you? It means we need to look at health insurance through the same framework I use for every financial decision. Safety, liquidity, and return. Safety. An unexpected medical event can wipe out your emergency fund, force you into high-interest debt, and derail every other financial goal you have. Liquidity. Medical debt ties up your cash flow for years. That's money you can't use to build wealth, handle other emergencies, or invest in opportunities. Return. The return here is protecting everything else you're working hard toward. Your home equity, your retirement accounts, your children's education fund, all of it stays intact when you're properly insured. I see too many families making decisions based on monthly cash flow without considering the household's overall financial strategy. They'll shop around for the best mortgage rate, but skip health insurance to save $400 a month. That's strategy. That's hope disguised as planning. Remember, when we talk about strategic debt management, we're not just looking at what you owe. We're looking at what you could owe if something goes wrong. An uninsured medical event doesn't just create debt. It creates the worst kind of debt. Unexpected, unavoidable, and often negotiated under the worst possible circumstances. Bottom line, if you're currently uninsured or underinsured, I can connect you with trusted insurance professionals who can review your options and make sure you're properly protected. And if you're already dealing with medical debt that's throwing off your household budget, let's talk about repositioning that debt strategically. Visit rsrlinks.com/keysteps, rsrlinks.com/keysteps to get your financial house in order, or head to RonSiegelRadio.com to learn more about protecting your family's financial structure. Because strategy beats rate always, and that includes the strategy of having insurance when you need it. I am Ron Siegel, your certified liability advisor, helping families build wealth through strategic debt management. That's the Borrow Smart segment, brought to you by GetHomeSelect.com. GetHomeSelect.com. Thanks for listening.